historically with chemotherapy, we attack the tumor DNA, right? And so the whole idea was to kill off the tumor. And what we came to learn was that even if you are able to kill all the tumors, you can see they tended to come back, okay? And one of the early lessons we learned was that even bone marrow transplant, where you're given mega doses of the drug so that you destroy a person's bone marrow, didn't always cure people. And where you had the most cures were where you actually transplanted with cells from another person. Okay, and so this brought into light the idea that even when you destroy the bone marrow and you destroy all the cells, you can see there were a few left that still grew back. And if you have bone marrow cells from another patient, it's recognizing your cells now as foreign. So their immune system is able to clear the few tumor cells that are left. And so even though the immune system had been seen to be very important and we've tried to attack it for years, I think bone marrow transplant and the success of allogeneic transplant was one of the first instances that told us that the immune system was important. The problem with transplant was that the donor cells also attacked the normal host cells. So you could get cures, but at the same time you could get graft versus host disease that killed a lot of people. And from then we had our initial successes with antibodies, which are going to bind on things on the cell surface. And now we have some successes with angiogenesis, which is really new blood vessels that supply the cells. So more and more we are understanding that it's not just the tumor cell itself, but the environment in which the tumor cells exist. And so if you could attack the tumor cells and you can attack this microenvironment, then in a sense you might be able to actually cure some of these cancers. The other idea also is that if you're actually attacking the microenvironment and not the tumor cells themselves, a number of times we think of the microenvironment as more stable. You don't have a lot of changes, mutations, and so on. So you might actually not have the resistance to therapy that we now have, because we are having a lot of successes by targeting specific molecular abnormalities in the tumor. But what we find is that after a short time, the tumor gets smart and uses other pathways, so you get resistance. And if you look at preclinical models, usually targeting the microenvironment tends to be pretty stable.